South Asian media has an immense responsibility to take this opportunity and the noble service that you're providing and share it with the community. We know Orbis through Flying Eye Hospital since 1982, about 30 years, have transformed and treated of lives of 15 million people. About 4.7 of them are children in 89 countries.
That's correct.
What we want to know is, can you share us your mission to Canada now?
Yes, well, of course, our mission in Canada is to fulfill our greater mission, which is to prevent and treat blindness while providing quality eye care to transform lives. Here in Canada, our responsibility is to raise funds and awareness about our greater cause. And so what we do is we engage members of the general public, and we found that a lot of members of different ethnic communities have really rallied around our cause because they want to be able to contribute to those who come from their country of origin. And perhaps they can't go there and do it. So through Orbis, they are able to address a global blindness issue that's affecting tens of millions of people around the world, and those right there in their country of origin. So we give them that opportunity to do it. They can do it through a monetary donation, and they can also do it through volunteerism. Even coming out and helping us to volunteer at our events is a wonderful way to contribute to those who need our help. And so we welcome all members of different ethnic communities.
Yeah, like how does Orbis help people in the remote area?
What Orbis does essentially is we first need to be invited by the Ministry of Health in any particular country. And then what we do is we partner up with specific hospitals depending on what the particular need of the country is. Based on that, we will then design a project that is suitable for that country and is designed to help to train and to teach the local eye care professionals there, and particularly those that are working in those partner hospitals. What then happens is when our Flying Eye Hospital comes, the hospital then selects particular patients that will help to fulfill the needs of that particular project, the ones that are cases where we can train and teach those who work in the partner hospitals. And so through that, we are saving many pairs of eyes, and we are eliminating a lot of blindness throughout the developing world, because our focus is really to build the capacity of our local partners, and through that we're able to save individual pairs of eyes. But our effect is so much more than that, because what ends up happening is when you train and you teach these eye care professionals, they're then able to turn around and to treat the people in their own country, and it's a multiple effect, and it's really, really quite remarkable.
We feel now that you're having an exclusive interview with the local newspaper that Orbis is reachable by average person. Can you appeal to recruit volunteer if there is a need in a specific area or a location, and does a culture or the language play a role?
Absolutely. There are many different roles for volunteers within Orbis. First of all, I should address on a global level, if anybody in the Tamil community is interested in volunteering for Orbis from a medical professional perspective, for example, any ophthalmologists, any nurses, any biomedical engineers or anesthesiologists, what we would ask is that you could send through your resume, your CV, and you can do so by visiting our website at www.orbiscanada.ca, and we will give you all the details of where you should send that resume, and then there will be a further application process. Those who are just average people who want to help out, there are many ways in which we can do that. First of all, we can engage members of the Tamil community by helping out with various fundraising events. You can even do your own fundraising event in the community and designate your funds to South Asia. We also have our own internal events where we welcome many wonderful volunteers coming on board. And what we ask is that everybody who participates in any type of event or function or activity for Orbis in Canada becomes an advocate for sight. Because Orbis is not a household name, we're unable to reach everybody that we want to. So we rely heavily on the members of the Canadian community to help get our message across. And so just by helping Orbis, you then become an advocate for sight.
Great. Finally, can you appeal to the community? The Orbis is going to be here in Toronto in November, I believe. Can you give us specific dates and specific events so people can come and visit you guys?
Very excited, because at the end of November, the Orbis Flying Eye Hospital is going to be in Toronto at Toronto Pearson International Airport. This is a rare opportunity, and we invite all members of the general public to come out and to tour our world-class aircraft. What you can do is you can visit on any one of those days, either November 17th, November 18th, or November 19th, and we have our tour times posted on our website. You're welcome to come on any of those days, and we welcome all members of different communities, and we welcome different community groups to come on board the Orbis aircraft. What also you can do is we're having a grand reception on Friday, November the 18th. We're having a party to celebrate the Orbis aircraft being in Canada. You're also welcome to that as well. All the details are listed on our website at www.orbiscanada.ca.
Good. Is there any cost involved in this tour?
There is no cost to tour the aircraft. That's why we open it up to everybody. But because it's not an inexpensive affair to have this aircraft coming to Canada, we are kindly asking for a minimum of a $20 donation to Orbis Canada that is fully tax receivable. However, if you're unable to make a donation, we still welcome you on board.
Thank you very much for your time.
Thank you. Thank you so much.
The mission of Orbis is extraordinary. Being able to play a role in eliminating blindness, eliminating avoidable blindness worldwide is amazing. 39 million people in the world are blind. 90% of the people in the world who are blind are in developing countries. 20 million children in the world are visually impaired. 80% of the blindness in the world is avoidable or preventable. Preventable blindness that is due to things like cataracts, glaucoma, macular degeneration, diabetic retinopathy, conditions that in the United States are easily treatable. That's not true in the developing world, where access to eye care services is extremely limited.